Have anyone new that wants to introduce themselves?
I will be happy to speak up. I'm new-ish. My name is Mindy, and have an echo. Can you all hear me? Okay. Anyway, I am the new CEO of NCHL, and I started with the organization in late October of 2024. And this is my first opportunity to be part of this group. So thank you so much for welcoming me. And I'm very excited to get to know you and work together in this capacity.
We're so glad to have you, Mindy. Thanks for joining us. Would anyone else new to the council want to take a minute to introduce yourselves?
Hi everyone.
I know,
Sorry,
put you.
I knew you were pointing at me, Jen. I knew that's where it was going. Hi everyone. I'm Michelle Hill. I'm a leadership coach at the Medical University of South Carolina. I see some of my MUSC folks on here. How y'all doing? And I have been a member of NCHL for a while. I was formerly on the DEI Council and still pop in there every now and then as well. I'm excited to be here on the Leadership Council with another coach, Joe, who's down there.
Wonderful. So nice to meet you, Michelle. That's right, Adam. This is your second official meeting, Adam. So thanks for throwing your intro in the chat again. And anyone else, I don't want to rush if anyone else wants a chance to introduce yourselves. I recognize most everyone though. Okay. Well, Jen, I think, do you have any updates from NCHL you'd like to share before we roll with the agenda?
I do, thanks. So many of you were on our last call, but we've updated our agenda format, so it's a little bit easier to navigate and has all the links to all the things I will reference. So whether that's registration for events that are coming up in terms of webinars, things like that, all will be linked in there. Thanks, Crystal. 2 thumbs up. A little bit easier to navigate, right? But the one thing I did want to highlight is our spring Leadership Excellence Summit. We do want to get a gauge on the number of folks that are thinking about attending. It's going to be in Columbus. I think Jess is already registered, so 2 thumbs up for Jess. But we have a great outline ready to go, and we're looking forward to partnering with Ohio Health on this event and using their facility and being able to share some of their campus with you all for this meeting. But I wanted to get an idea of if you're thinking about coming, not sure at this time. I'm going to launch a quick poll. If folks could just respond real quick, that'll help us and our planning committee be able to gauge a little bit better how we can shape the agenda, how we can think about the best use of time for folks.
Well, Jen's launching that poll around the Spring Summit. Does anyone have any questions about the Spring Summit this April that we can answer on this call? One of the focus areas is leadership development along with well-being. So I think, and talent metrics along with environmental sustainability at this stage. That's where our heads are at in terms of the content focus, but we need additional input from our councils to make sure we're on track with that. So if you are planning to attend, please let us know. Jen, I don't see the poll yet, so I don't know if that's
strange. We have 10 respondents so far.
Okay, great. Now I see it.
Give folks just another minute to do that. The other thing that I wanted to highlight was the call for content, like Megan mentioned. We are looking for a variety of topics, but our call for content's also open for both of our events, our Spring Summit and our Fall Summit. So we have all of our council topics kind of lined up for content. So we're looking for you or your teammates or your organization to submit and share some best practices in person, whether that be at the Spring Summit or in November back in Chicago. So again, that link is in the agenda, along with registration information if you're curious about that, as well as complimentary tickets. Each organization gets a certain number of complimentary tickets based on your membership. So we're tracking all of that on our end to see how folks are utilizing their tickets for the year. So you can check that out as well. I'll go
So
ahead.
Jen, the only other thing I would say is if anybody responded unsure, my question back to you all is what additional information can NCHL be providing to help you make a decision whether or not you think you want to attend or not? Jen, do we have responses?
Yep, I will share. So.
All right, so from the 50%, I'm just curious if anybody would share what additional information or if, for those that responded unsure or no, just some feedback would be great in terms of your decision there. Thanks, Adam. Anybody else have any feedback for us in terms of not attending or unsure? Thanks, Michelle. Thanks, Joe. Okay. Well, thank you for that feedback. If anybody else has additional feedback, please just let Jen know. And we'll try to further develop and refine our agenda to make sure that all of you who are unsure can make a decision based off of the content. We're really excited about some of the potential content and hope that that will generate additional interest in the event.
Thanks, Megan. No other updates from my end in terms of our NCHL business, but I did want to highlight, we're going to talk about leader onboarding today. And I did find some resources that I thought were helpful when thinking about the effectiveness of onboarding, specifically executive onboarding, and then the first 90 days, and thinking about how you all are kind of looking at onboarding in 2025. So I will hand it off to Jess to kick us off.
Thank you so much, Jen and team, and for your feedback on the summit too. Looking forward to that. I can say, just having been to several NCHL conferences and events, they are all worthwhile. I have really taken away a ton from any that I have attended. So I have no doubt that these next two will be the same, if not even better. So just a little plug there. But yeah, so Jen and I put our heads together to think about some topics, and just if you recall, towards the end of last year, I think in our December meeting, we had some open discussion about, what are the hot topics for you as we look into 2025? What are the pain points, the areas that you're looking to, maybe you have something existing and are looking to revamp or evolve. And one of those topics that came up was looking at how we onboard new leaders into the organization. And I think, of course, I've got a couple of my UPMC team members here too, and we can speak to some of the steps we take. But I would imagine that many of you also encounter what we do in the respect of a lot of, which is great, folks moving through our pathways and going from individual contributor to becoming a leader for a first time in the organization. So I even think that's a little bit of a different nuance. And I'd love to hear about how you address and support those leaders, really stepping into a leadership role for the first time. And of course, leaders who are joining the organization from the outside. So I don't know, and kind of generally, we have a couple of discussion prompts. Starting off with how do you onboard leaders into your organization? And I think, of course, we're interested in any of the kind of programmatic, educational components, but even kind of big picture, we know there are lots of parts that can make up a really effective onboarding for a leader. So would love to hear from some of you if you're willing to share what you currently do, and even if you're on a journey to continue to enhance that. So I'll open it up to the group and see if anyone might want to kick us off. Well, yeah, Crystal.
I'm happy to share what Memorial does. So once the pandemic was on a downhill slide, we brought back in-person leader onboarding. And so we do a monthly session, whether it's one person or 15 people. We make sure we hold it every month, so it's on a consistent day and time. And we have kind of taken the approach with, this has been kind of an evolving onboarding, and we've taken the approach that we want to really focus on what it means to be a leader at Memorial to start off our day. In previous iterations of onboarding, we had focused more on like tactical and operational items. And we were really missing that piece of connecting with people and leading people. And so we want to highlight that from the beginning. And then we transition that into just this idea that, people are our most important asset, and making sure that we are being inclusive. And so we have our equity and experience vice president come and spend an hour with the team talking about that topic at Memorial as well. And then we transition into a little bit of an overview of the leadership role as it relates to privacy and compliance. Being a healthcare organization, of course, we know how important that can be, and to kind of help our leaders understand, what are the expectations of them should someone violate privacy here. And then we transition kind of back into some wayfinding to help our leaders know how to locate resources through the various applications and platforms we use to store, important information that'll help them kind of kickstart their journey. And then we close out the day talking about how talent management can support them throughout the entire year. And we have them leave with a first year learning plan. So we already have kind of laid out, here's what we think would be really good and helpful for you to take in your first 12 months at Memorial. Of course, they leave with a call to action, because we tell them so many things in that first day. We want them to know, like, what do I do once I leave? And then we are currently in the process of looking at developing a day 2 of our onboarding program to focus on, initially we were looking at like just technology as a broad kind of sweeping thought, because we again have so many different applications and things that could be important for them to use. But we've kind of shifted gears a little bit into thinking about just focusing on human resources, and whether or not that relates to technology or, conflict in the workplace is prevalent. And we've seen an increase in reports of, incivility. And so we're fleshing that out in this coming year. Hopefully, and maybe the second quarter, we'll see the beginnings of that kind of coming to light. So, and we've just implemented a 60-day check-in. So we do one-on-ones with each leader in 60 days. Or 90 days, sorry. And then in 6 months, I do another one-on-one with them to see how it's going, make sure if there are any resources and barriers. And then each new leader is also signed a coach. So those are kind of supplemental things that we have in the background too.
Really important things. Thank you so much, Crystal, for sharing. I was curious too, in your day, so it sounds like much of it is maybe delivered by your team with a couple of leaders who come in, and then is it your team that's conducting those check-ins with the leaders at those points in time? Interesting. Yeah.
Yes. Now we have had, we've seen a significant reduction in the number of leaders that we're bringing into the organization as well. So at this point, there's 8 of us total. We're all focused on different things, but it's manageable right now between myself and our talent management specialist. As we see, and then of course we have a certified coach who is the coach of all of these individuals as well. If we see a larger increase in numbers, we may have to kind of regroup to this approach, but that's the current approach.
So I just want to clarify, Crystal, you have one coach for all of your new leaders?
Yeah. So we had 2 certified coaches who focused on all of our new leaders. One focused on directors and above, and one managers and below.
Gotcha.
And then one of our coaches pursued an opportunity somewhere else. And so we're down to one certified coach that handles everyone currently. We do have another, Alice Leafers, of course, is a certified coach as well. So she may take on some executives, but our one coach handles all of our new leaders and our current leaders. That's a full-time job.
Truly. Well, and that's what I was maybe going to ask you too, of what is about that volume that you see of new leaders coming in to the organization?
Great question. I'm trying to remember. Last year, I think we had, somewhere between 30 and 40. Now this year already, we've started to see an increase in our numbers. So I anticipate we'll probably be close to somewhere between 50 and 75 by the end of the year. Historically, we've typically onboarded about 100 leaders a year prior to the pandemic. So,
yeah. Wow. One more question, sorry. And of course, anyone else. I love hearing everything everyone's doing. So I love the idea that you all are conducting the touch point, that check-in with the leader, because we have a similar approach. We have a 90-day check-in process, but the accountability is on their leader to conduct that conversation. And I think we all recognize in some places that's a great conversation that I think is really an opportunity to transparently check in and get realigned. In others, I think they're checking the box in our HCM and saying, I did the 90-day check-in. So I'm curious of like the information that you gather from those touch bases. What do you do with it?
That's a great question. Full transparency, we are implementing it now. So we actually haven't held any of these meetings yet. So I would say that for our 90-day checkpoint, our talent management specialist is going to conduct those meetings. She has interactions with them as they begin in their journey. So it won't be unusual that she's there, right? So we've got a set of questions that she'll ask, and those questions will really focus on, like what's gone well. So help them celebrate some successes, find out if they have any barriers in their journey. If she can't answer the question to get them to the right place, then she would engage me in the process. Now, if we hear like, a leader says, things aren't going well with my staff, I really need to approach this a different way, we may do some interventional work with them as well and kind of dive deeper into what's going on. So I do have ideas in mind of what we'll do with it. Right now, I'm going to be creating a database for her to input all that information into, so I can send it out to the right folks along the way. And so yeah, I'm intrigued to see how this goes. I think I felt a huge gap last year, and I would see the individuals on the first day, and of course they have their coach, but I actually don't see them again after that unless they reach out to me. And so this is a little bit more proactive and helping keep connected in their journey. So to your point, right, we have some leaders who are really great at retention and really great at connection and being with people. And we have some leaders who are really great at it and also have other things going on. And then we have some leaders who are horrible at it. And so we're trying to kind of figure out how to bridge that gap for sure.
That's great. I mean, I'm just thinking even the real time, oh boy, we got a red flag here. We've got a risk. Like it's that just an opportunity to try to address it before it goes too far.
Mhm.
It's great. Thank you so much for sharing, Crystal.
Yeah, and I would just add too, I think there's an element of, I kick off the day and I'm super passionate about how important it is to connect with people and build these relationships. And so I also take that train of thought in mind and keeping connected with these leaders, right? Like I'm building these relationships with them, and if they don't feel comfortable and confident that they can call me to help, remove barriers for them, then am I really qualified to stand up and say that's what they should be doing, right? And so, like, I think that's really important to model that way and those behaviors and help them figure out how to translate that into their relationships too.
Absolutely. Wow. Thank you. Any other questions for Crystal, or anyone want to chime in and share some of what you're doing too? Michelle, I saw that come off mute.
Well, I actually was going to share, and this is something that I think has just started because I'm in one of the cohorts and we're on cohort D, but so I want to say a couple months ago, we started onboarding our leaders on the health side of the system with our new leader onboarding, which is 3 full day meetings at 30, 60, and 90 days after leaders come on. Either they're new leaders or to the organization, or they're new leaders as in they've never been a leader before. And it's pretty comprehensive. I just learned about it when I walked into my new position. So because I had been thinking, what are we doing for our new leaders? So I was very happy not only to see that something was happening, but get to actually participate in it. The classes are anywhere from 5 or 6 people to 25 to 30. And because they're starting pretty frequently, I think we're on cohort F now, and like some of them are still going. They're very, very information heavy for the leaders, which is incredible because we have a large organization and we do need to be getting this information to our leaders. And they cover everything from how do you log into our HRS management system, RDAY, and how do you pull up your reports and, figure out FTEs, all that good stuff, to emotional intelligence and DISC reports, and how do we actively listen. And we also have our coaches on the health side come in and teach coaching tools to the leaders so that they have some tools that they can use with their new reports. And then they are rounded on, I believe, by their leaders every 30, 60, 90 days as well. So it's a pretty great program. And I'm like super excited to share it with you guys.
That's awesome. Thank you, Michelle. And if living it and experiencing it yourself, right? That can be a different perspective. So an appreciated one. It's kind of same question for you, Michelle, and I apologize. Remind me which organization you're with and about like the size, volume of leaders that come through, if you know.
So I'm pretty new, so I'm not sure about how many leaders come through. I would say that there's an average of in each class about 20. So we've probably trained 150 to this point, and we're only about 6 months into the program. So, and then I'm at the Medical University of South Carolina.
Got it. Thank you so much, Michelle. Any questions for Michelle?
Michelle, do you all do any training for your leaders on how to onboard their leaders? I was trying to say that and not be confusing.
I don't want to speak to that. I'm not part. The training development team is on my team, but as a coach, I don't really do that. But I know that they do consultations, our training and development team. So they are rounding has become a very big concept at MUSC, not just on patients, but rounding on care team members, which are what we call our employees. And so I know that our leaders are being taught to round on other leaders and on the folks who are following, the folks who are reporting to them. And we do have rounding classes because that's also kind of a relatively new phenomenon. We have developed a class that we're teaching people like what that means.
Hey, all, and I can also kind of speak to that. I work with Michelle at MUSC. We don't have a formal how to onboard kind of course yet for leaders, but we are in the very, very early stages of developing kind of an enterprise-wide onboarding and what does this look like and how do you, as a leader, kind of do that exactly with your team. So it's in the works. We're in the early discussion phases, so I'm not quite sure what that timeline will be.
I love it. That's a big goal and something we're talking about for 2025 as a plan as well, is not only leaders onboarding their colleagues, but leaders onboarding leaders. I think when the pandemic hit and we tried to offload some of the work on our leaders, and now we got to figure out how to teach them and give it back to them because we're doing some things that, you know, we can generally overall do on how to, you know, approve payroll or how to have your people sign off on their time cards, things like that. But some areas do things differently. And so if I said to a leader, like, everybody should sign off on their time card, and the leader's like, I don't even know what you're talking about. Well, great. So trying to figure out how to get some onus, I think, back on the leaders to not, again, only help them onboard, but connect with their leaders in a different way too.
I had a couple of thoughts just listening to you all. So prior to joining NCHL, I spent my career in healthcare operations, both in academic medical centers, and then also I spent the last 14 years working for a really large 40-plus-year-old national publicly traded physician services organization. And I say all of that because it sounds very fancy, but I can't say that in my career I have really ever had an excellent, organized onboarding experience. It was homegrown in all of my jobs, mostly by me. And it lasts for a little while until you're okay. And then you're just kind of let loose to figure it out. So as I hear what you all are talking about, I think there's such value in developing a best practice model for executive onboarding or employee onboarding in healthcare organizations. Because to me, it just feels like, personally, it's been a real void. And I think with that, it's probably been harder to succeed and make an impact out of the gate. So those are just some impressions. And then secondly, what I wanted to just kind of toss out is that the more folks that I talk to in my role within NCHL, I'm hearing things like, we really want to know where to look for the benchmarks and for the best practices and for the success stories. So I think along those lines, as we think about the value that this group could potentially bring to NCHL and then to the larger healthcare community, it would be finding organizations, either member organizations or even non-member organizations in healthcare or outside of healthcare that are really good at this. And could we bring somebody to showcase the success, but moreover, what the outcomes are? And that just, I think, would have a huge impact on attendees. So just some ideas and thoughts.
That's so helpful, Mindy. And I agree. I think I don't know, and while I feel confident in some of the programmatic efforts for onboarding, I don't know that all of those surrounding pieces, you know, if you asked a leader in our organization, would they say, Yeah, absolutely. It was smooth sailing, really effective. I felt completely set up for success. And I think,
Yeah.
and that's too why I love this group, because I think we all come and I'm like, ooh, I'm going to steal that little bit.
Yeah,
Like,
that's what
that's
we're
a
here
great
for,
idea.
right? So let's maybe we package that. I think there's a lot to be said for this and helping to set people up for success. And the reality of healthcare is not that we have a lot of time to come in slowly and ease in, and you got to learn while you're doing. But we can do better, I think, as an industry to support our workforce. And I'm sure that it impacts retention. I'm sure of it.
Absolutely. There is some like wild stat that says within the first 3 days, essentially, you've decided if you're going to stay or not.
That's
Whether
it.
it depends on how long you stick around
Yeah.
still, but that it's a pretty quick decision that someone can make based on all of those experiences. Mm-hmm. Adam?
Yeah, real quick. I have a question and then just like a comment based on what we were just chatting about. I think one thing for us, and I don't know if this applies to other folks, but I think like the partnership between HR in our case that leads the orientation, especially on day one for general staff, and the partnership that we have with the departments as they do their onboarding, that connection is something that we're really trying to figure out so that it is a comprehensive, great onboarding experience. But my question is for Crystal and for Michelle. So first of all, thank you so much because this is so timely and something that we want to do at Rush to really develop a leader onboarding session. Previously, it's been more ad hoc kind of things throughout the year. And so this is really exciting for us to kind of hear from everyone and their expertise. My question is, when did you start this program, and specifically, how did you kind of deal with the scale of new leaders versus the leaders that have not had the training? Is there a model, or do you include them? Is it optional? Would love to get your thoughts on how you include those that have already been, who are there, but have not had the training that you've all developed.
I'm happy to share first. So I would say that from a leader onboarding perspective at Memorial, it has gone through many different versions, many different iterations. And when COVID hit, we stopped all in-person learning and development. And so we transitioned into this like 19-page resource guide that we gave our new leaders and said, good luck, call us if you need anything, right? Like, but we're not going to stand up and do these things. And so once we got into gosh, I think we were not live for maybe a year. And then we decided, you know what, this, like, we're going to have to figure out how we live in this environment. And so once we were able to gather again in person, whether it was masks or not, we initially we looked at everyone who was hired in that last year that maybe we missed. Now, because we had a hiring freeze and then we went through some reductions, it wasn't a ton of people that we missed in that moment. And so we invited them to a pilot course to like kick off leader onboarding again. And then we every year take a look at the content and how we're doing and what maybe is changing in the organization as it relates to the strategic vision. And so this current iteration of onboarding just started in January in the format that I described to you. And so what I would say is, we've heard feedback of, oh gosh, I didn't get that onboarding, or we affiliated with an entire organization and then COVID hit. And so none of them were onboarded into Memorial. And so what we've done is like, we will open it up to anybody that wants to come, right? So if I see a leader who maybe transitioned into a staff level role at some point and then now is back in leadership and they didn't come to this onboarding, I'll personally invite them to come. If I've seen leaders from Decatur, because that's who the affiliate was, who have been leaders over there for quite some time, they're transitioning into another position, I'll offer it to them and let them choose, right? And I'll tell them, here's the content of the class. One of the biggest pieces of feedback we heard last year from our kind of operations management team is that they had no idea we were doing onboarding. And that's like a kick in the gut to somebody who's responsible for it, sitting in there every month doing it. And so, but it's good, right? Like, because that's perception. And so how do we kind of close the gap with that? So I created a dashboard that actually shows all of the leaders that are starting, the percentage of completion along their first year learning plan. So how they're doing with that. And then also I took it a step further to say, like, okay, at your affiliate, we have this many leaders who are there. We offered this many classes in the last quarter, and this is how many people are actually engaging in them. So that's kind of taking it a step outside of leader onboarding, but we are still trying to connect and say, like, this is out there. Here's what we're doing with it. And anybody can come to it, whether or not you've been a leader here this long or just started yesterday. So I don't know if that fully answers your question. I think I gave you a little more than you asked for there, but that's how we approach it.
More is better. So all good. Yes. Thank you.
And I'm just going to say that we just started this program, like I said, about 6 months ago. So word is getting out about it. They are allowing people who want to attend, but they also offer a condensed one-day version for people who might want to take the class, don't have 3 days to give, but have already been at our organization for a while. And so they know some of the things like how to log in and how to, do those things. So, and then on that day, they focus mostly on like the conflict, emotional intelligence, those aspects of it.
Thank you so much.
Great sharing, great questions. Anyone else want to share a little bit about what you're doing for manager onboarding? Marielle, I saw you unmute. You want to talk about what we do?
Sure. So I just wanted to speak kind of briefly about what we do. I came onto the team a little bit less than 3 years ago. And so I, unfortunately, kind of hearing your guys' onboarding experience, coming onto this team was the best onboarding experience of any career I've ever had. So I feel very, very, very lucky. But I think obviously it's because we know, like, the team knows what they're doing. And so that definitely made all of the difference. But it's been something that I've kept with me. And so when even we're facilitating our, first days of, leadership development of any sort, it's like kind of a reminder of, like, you're really the one setting the tone here. And so sometimes it's just explicitly saying that. But to speak to what our team does, so kind of similarly to a lot of you, we have it that all of our leadership onboarding is open to anyone that has moved into a new leadership role or is new to the organization. But in the last 6 months, we actually extended it to anybody. And it has really helped to just kind of get some people their foot in the door to leadership without fully being there and starting to understand kind of some of those nuances. So kind of as you guys are talking about scaling this, that might be something to consider, as well as those people that aren't there just yet, but are, kind of being slated to move into leadership roles to help them be more confident in doing that. So our day starts with kind of similar to Crystal. I think you said really setting the tone for, like, what does it mean to be a leader here? And we tie it explicitly to our values. But then we speak to the retention efforts and ways to consider, building retention, building engagement within your team. It is a more soft skills focus than some of those more technical skills, because we realize that they've probably gotten an onslaught from HR of those more technical pieces. And so it really is just an opportunity to talk to that. But the thing that I think makes our leadership onboarding really unique and is always seemingly the crowd favorite is that the last hour of the day that we spend with them, and we normally have about 6 hours with them, and we do it virtually. But the last hour of the day is leadership panel. So we have other executives throughout the organization that spend an hour answering the new leaders' questions. So it's not us telling them what to say. It is just really an open dialogue. And it's been one of those things where, frequently we can kind of figure out what questions are going to be asked. Have you transitioned to a team that you once were on, or, those types of questions. But there's always the question, what mistake did you make? And just hearing from a leader, like, it's okay, you're going to make mistakes, but there are people that are here to help you. And some of those conversations, those seem to be the most beneficial part of the day. And it always luckily ties back to everything that we covered in the morning without trying. So that's always good. But it really is something that I never, as I mentioned, never experienced before, but we frequently receive feedback that is everyone's favorite part of the day. So Jess, Jen, Robin, if there's anything else I missed, but yeah, that's our stuff.
Oh, I thought that was great. And and I will, because I was facilitating what we used to call Journey to Management, like 12 years ago. I remember, I mean, we've really been on our own journey with it because we spent the bulk of our time on how do you do corrective action? What do you do when a leave of absence comes up? And I think we have recognized so much. Folks weren't going back to those reference materials. They didn't care about processing a leave until they had to process a leave. And then they wanted to know right then, how do I do it and what's expected of me? And so we really have made this shift over time. And one of the things that we, in connection with Drive, which is our new leader program that Marielle and Robin helped to deliver, is functionality in our system called a journey. And so every new leader who either comes in from the outside or is promoted automatically gets assigned. And it's sort of like a task list in our HRIS system that walks them through, so here are resources related to it, but like all of us, I think we have no shortage of resources on it, right? It's just, where do I go for that information when I need it? And so it addresses where to find some of those elements versus saying like, good luck and God bless, go out to our Infonet site, our intranet site and find it, do a search to see what you come up with. We've tried to organize it in a way that they'll then be able to go back to that if and when they need to access that more kind of just in time tactical stuff too. And we've gotten good feedback on that packaging. So then it allows, I think it's much more enjoyable for our facilitators too, to not have to talk about leaves of absence. But we lean heavily on our HR partners, and we probably see between 1,000 and 1,500 new leaders in a year. And so just our ability, I saw that face, Crystal, like our ability to really wrap our arms around how do we do this in the most impactful way that we can. I love the idea of every new leader getting a coach, and would be my dream. I think from a retention perspective, that would make such a difference. But we have to lean really heavily on our HR partners who sit kind of more locally in our structure. But we did work together a few years ago to develop an executive onboarding approach. I will say it's a paper document that the HR VP pulls out when an executive's coming in, and we all kind of, a few of us kind of huddle around it and go, okay, how do we make this experience the best for this individual? But it addresses like all those little things of like, have you maybe sent them like a little welcome package? Have you set up a dinner whenever they arrive? Does their assistant have everything that they need? Even who are the meetings that they can have for folks who are going to tell them what the culture really is, right? And what they need to understand about the nuances of, when you're in that meeting, this is the leader of it, but this is really who's leading the meeting. And so we tried to kind of make them walk through those considerations too, of like, how do you really get this person set up for success at their level? The other thing I wish we could do, and I would be curious from all of you, is how much new leader assimilation do you get to do, or have you done in your locations to also have that connection for the new leader with the team? Do you do any of that? No. Yes, Crystal.
So we offer as an option new leader integration coaching, which involves the team. And again, we've kind of got that not three, but we have set of questions. Our coach goes in and talks with the team, then comes back with the leader, does a one-on-one, and then the leader goes back and does the third session. It's an optional item right now. We strongly encourage it for directors and above. But during my initial meeting with every new leader, when I just kind of welcome them and go through what to expect prior to their first day with me, I tell them about it. So it gives them time to kind of process and think through it and ask those questions. And then I absolutely share with them, if that's something you're interested in doing, coach can help you. But it was interesting that, first of all, 1,500 leaders, holy smokes. But it's interesting that you said that about leaning on your HR partners, because one of the conversations we recently had was around, is this something we could tag in some of our HR directors who are assigned specific affiliates of our hospital, that they could be managing the integration coaching and also start building their relationships with these new leaders from the start. So we have a formal process. We don't have a mandatory process, I guess, if you will.
It makes such a difference. I think there's a lot of research that shows like just those expectations on everybody's part, and setting that up, clear communication, I think goes a long way. And that's something I wish I could also give to every new leader and team. Does anyone else want to share what you do, or if you have specific pain points or things that you're trying to address in enhancing your overall manager leader onboarding? Are we exhausted? Oh, go ahead, Mindy.
I have a question, actually. This is obviously your area of expertise, and I just was looking. It seems like there are a lot of companies where an organization could contract out for onboarding services. Can you just talk for a minute about how common it is for healthcare organizations to actually just admit that it's really hard to do internally, and it might be a better decision to just buy it as a product? The reason I ask, aside from just being interested, is that one of my previous organizations did that for a clinical leader mentorship program, and I was really impressed with the product. And it's always like the make or buy decision. And I think we even hear that a lot within NCHL for some of the leadership development programs that we offer our members. Can they do it internally? Can they get it someplace else? And how are we unique? I was curious about that.
I think it's a great question. And it makes me think in line with, and Crystal, you have an internal coach, but the idea of engaging external coaches too, which I think has become a lot more accessible through platforms like Ezra and others, a lot less cost prohibitive. But I feel like, at least in our world, we don't have a lot of buy it. It's either build it or, oh, that might be one we've got to let go a little bit, because we just don't have the ability to make it to the quality that we need to, the highest touch. But I think it's a really great question.
Mm-hmm.
Well, now I know my new side business. I guess we can start to work on that. I was cracking up. I told my team we had a chance of a group of public school students came in, and they asked a few of us to talk about what we do. And I was sharing about what we do. And the one student asked me, well, could your team just pick up and like take what you do and like make your own business to do it? And I said, well, yes, I guess technically we could, but we're not going to do that.
Yeah.
See how much time we have. A few more minutes left. Any other thoughts? I think last meeting got me thinking too around leadership frameworks, and that's something that we kind of have ongoing discussion about, because when it comes back to that, it sounds like a lot of us take that approach of what does it mean to be a Northwell leader? What does it mean to be a UPMC leader? Like we kind of have that common, and I think I'd like to be able to create more of expectations related to level of role too for leadership, ways to help them kind of continue to accelerate their own performance, understand what do I have to kind of let go of to ascend to the next level. But we haven't been able to get to that kind of level of detail. And so curious if you all have kind of more detailed frameworks for leadership, or if you keep that a little more broad in general. Don't know if you have any thoughts to share on that end too.
So, hi, it's funny that you mentioned Northwell. My name is Janine Phillips, and I am from Northwell. So right now we do have a leadership framework in that we have programs that surround really based on leadership level. So, and some of our other colleagues are on this call who lead those programs. But we have a emerging or frontline leader program, and that is really open to anyone in the organization essentially who is interested in learning about, leadership skills and really those emerging leader skills. And we have a leader of leader program as well. We utilize simulation for their pre and post skill self-assessment with a curriculum really focusing on what do you need at Northwell when you are now a leader who is overseeing individuals who have leaders reporting to them. And then we have an executive leadership development program, which is really geared toward leaders who are preparing for a vice president and above role. That program has 2 tracks to it, which are for physicians in half of the population, which is 25 individuals per year, and then our administrative or clinical preparing executive leaders as well. And so, we're definitely taking a look now at the leadership framework. We're making some plans to sort of do some curriculum renewal, where we're going to be really looking at all of the offerings across the board and essentially looking at what do leaders need at each of those levels and really integrating all of their learning. And so keeping some of the kind of special components within the program specifically that enable them to network together, gain more organizational exposure, really understand the organizational objectives and be able to be sort of change agents and leading in those areas, as well as really providing curriculum across the board regularly to our leaders so they can continue to develop.
It's awesome, Janine. Thank you so much for sharing. I have a follow-up question on what simulation do you use for pre and post skills assessment?
So it's case-based. It is a case in the beginning of the program that brings about the key focus areas for our leader of leader population. And so there is a checklist that we go through. The participant goes through a simulated encounter with one of our standardized patients from our clinical skills center, and then they complete a checklist so that they're able to ascertain, how well did they do in that encounter? What are some of the skills that they will need to focus on over the course of their 1-year program? And then they're able to kind of assign what courses they're going to take based on that pre-assessment, and then go back with a similar case, but a little bit, sort of a follow-up encounter to that to really gauge their, their skills and how they've improved over the course of the program.
Oh, that is so cool. I love that. We have this great simulation center, and I'm always thinking, like, how can we use it for more beyond those clinical types of encounters? And now you got me thinking.
Yeah, our executive leadership development program, we do the 360. We have emotional intelligence, TKI for conflict, and the Myers-Briggs. And we also, for our emerging leader program, offer conflict training. So there's also emotional intelligence. And so, yeah, so each program kind of offers something a little bit different.
That's great. Thank you for sharing.
My pleasure.
I know we have a couple more minutes. Anything else for the good of the group before we wind down? Thank you so much for all of your sharing and discussion today. It was great.
I do have one question, just from obviously not in your shoes perspective. We talk about survey fatigue and talk about surveying all of our associates. Are you all surveying after the onboarding process at all? And are you using any of that data to inform changes? Because I know Crystal mentioned changes, right, that they're making. Are you continually doing those changes based off data, or is it just kind of based off of the organization and changes to any frameworks there?
I think we survey our leaders that come through. I don't know that, I think it's a good question from like the comprehensive onboarding experience. I don't know if we have one that captures all of that, but we do specific to their experience with our program. Right, Marielle? Is that right?
Yeah, we do.
Yeah.
And I was just going to say, we've taken like the last year's worth of data and we've actually made pretty major changes to our programming moving forward in 2025 based on the feedback that we received there. So we're in pilot stages of that. We haven't actually rolled the new material out with our new leaders. We've kind of looked at it internally, but a lot of that has been based on feedback. And for us, the feedback we receive is within the week that they've done the training most of the time, but then we end up connecting with them because they come to another one of our courses. So we get kind of this anecdotal evidence that we've been able to apply as well. But that is one area that even our team has talked about is some more kind of long-term, 90 days out of this training, what did you get from it? Which is an area that we could definitely continue to grow.
Gotcha. At least you're using that for kind of a continual improvement.
Great. Well, good to see you all this month, and we'll look forward to seeing you in March.
March 6th, and we'll be discussing AI. So I know that's a hot topic for a lot of folks. Looking forward to that.
Me too. All right. Take care until then. See everybody.
Thanks, y'all.